Welcome back. On today's East Jefferson General Hospital Medical Moment, Camille Whitworth introduces us to Dr. Harry Roach, who shares his insights on carotid artery disease, its effects, and treatments. Take a look.
Today we are talking carotid arteries, and it carries blood to your brain. It is a critical function and it affects so many things, including your motor skills, even your personality. And it's right about here. It's that artery you feel when you check your pulse. Today we had the opportunity to speak with Dr. Harry Roach. He's a CVT surgeon here at East Jefferson General Hospital, and he tells us what to do if you have a blockage or an obstruction.
Symptomatic carotid artery disease manifests itself in many ways. You can have what's called a TIA or mini stroke, which includes facial droop, visual disturbances, confusion or disorientation, speech difficulties, weakness, or numbness in arm or leg. Yes, you can also have tingling in the fingers or toes. Yes, ma'am. Okay,
doctor, so we're sitting at home and we're wondering, what do we do if we experience some of these symptoms that you're talking about?
Well, since these are life-threatening problems, if you are having a stroke or mini stroke, if you see these signs, you should go immediately to the emergency room, preferably East Jefferson emergency room, and be evaluated, because there are many things we can do to abort these mini strokes or even strokes in progress and return people to their baseline function.
Here in our East Jefferson community, what is the frequency in which you see this?
Well, these days, as our patient population is becoming older and having more comorbidities, this is a fairly frequent event. We probably do carotid surgery on 2 or 3 patients a week in our practice. So it's a very prevalent disease process.
Okay, let's break it down for folks. Where is the carotid artery?
The carotid artery is in the front part of the neck, right behind these strap muscles.
And what does it do?
The carotid artery carries blood to the brain, which supplies the oxygen and nutrients to the brain that keep it healthy.
What is the worst case scenario for someone who suffers?
Well, people can have devastating stroke events from carotid artery disease. It is a major problem because strokes can result in severe disability, paralysis, inability to speak, and strokes can progress to death if they're severe enough.
A lot of people want to know, are there ways to reverse the effects of a stroke? Well,
we have a lot of techniques available to us at this point in time to help prevent these major complications from stroke events. Here at East Jefferson, we have a stroke team who evaluate the patients early when they come to the hospital. They get treated appropriately with either blood pressure management medicines. We can give them medicines that will dissolve the clot and prevent the stroke from progressing, and even have urgent interventions, including catheter-based interventions to repair this blockage or remove thrombus from the brain, as well as surgical interventions to prevent further progression of the stroke problem.
People will be watching and they want to know, are there ways that they can prevent blockages?
Well, unfortunately, the majority of the times, these blockages are asymptomatic. People don't know that they have them.
Now, there are some very distinct risk factors that people should know about. What are some of those?
Yes, there are 5 or 6 definite risk factors. So the best way to be on the lookout for them are to see if you have the biggest risk factors for the development of these stroke problems or carotid artery blockages. The first risk factor is genetics. If you have people in your family that have had strokes, heart attacks, leg circulation problems, heart bypass, it makes you at risk for having artery blockage somewhere in your body. Smoking is a terrible risk factor. High blood pressure, diabetes mellitus, high cholesterol, and an inactive lifestyle.
Exercise seems to be the cure-all for so many things. Will exercise help prevent this?
It will help prevent progression, but the things that we recommend are frequent visits with your family physician, who should check your carotid arteries by listening to them, and if you're in certain risk factor groups, you should have a carotid ultrasound, because, as I said, these may be asymptomatic, and the only way to find these blockages are with objective testing.
Dr. Roach, a lot of people want to know, if I do the right things, watch my diet, exercise, and all the things that you tell us to do, will the blockage just disappear? Will it go away?
I think the best we can hope for is the prevention of progression of the plaque. Once it's there, it simply never goes away. But today, the internal medicine doctors and cardiologists are very aggressive, treating patients with atherosclerosis or generalized heart disease or leg disease with beta blocker medicines, statins to help lower their cholesterol, aspirin or Plavix to prevent platelet clotting on the plaque, and other medicines to help manage blood pressure and diabetes to help reduce the progression of these plaques and to some degree prevent them if they're instituted early enough.
Let's talk now about some of the outcomes that you've seen and some of the outcomes you've experienced.
Well, here at East Jefferson, we've had some incredible saves. So we have some ingenious techniques here at East Jefferson that take people who are very ill, very sick, paralyzed, and are able to reverse their stroke and get secondary treatment of some sort to either fix or remove this blockage, which includes sometimes stenting, more often repair surgically of the blockage. And we've seen people come in with significant paralysis and brain dysfunction who end up leaving the hospital with a very good result and quite close to their baseline.
That's pretty great.
Well, we think it is, and we work really hard to get that.
Obviously, nobody wants a blockage or an obstruction, but if the problem should occur, the team here at East Jefferson General Hospital is dedicated and committed to treating you effectively. I'm Camille Whitworth, everybody. Thanks for watching.
Thank you, Camille. As always, visit ejgh.org to learn more about this subject.